Listen to me in this video is because I've been exactly where you are. My name is Yassine Badr. I have ADHD and I still managed to pass step 1 and score a 253 on step 2 CK, even though I didn't study well in medical school and had no real clinical foundation. So if you have ADHD, you know the struggle, the procrastination, the guilt, the frustration. You're smart and you know you can do it, but for some reason you just can't get yourself to start or even stay consistent. I get it. The reason is simple. You have been studying the neurotypical way. For an ADHD brain, that feels terrible, boring, painful, and endless. Every time you force yourself to study like that, your brain associates studying with pain. And this creates negative reinforcement. You subconsciously learn that studying equals suffering, so you actually start to avoid it. Then comes the guilt. You feel bad for not studying enough. The frustration hits because deep down, you know, I'm smart, I'm capable, but you just can't seem to finish what you start. So in this video, I'll break down strategies that worked with me and with other students who also have ADHD. But before we jump into techniques, you first need to understand what's actually happening in your brain, because once you get that, everything else starts to make sense. The main issue in ADHD is not a lack of focus. It's a problem with attention regulation. You cannot control when or what to focus on. Sometimes you can focus, hyper focus for hours. So the problem is you have focus and you have hyper focus, right? So let's simplify how your brain works. Your brain basically thrives on three main fuels: interest, challenge, and urgency. If something is interesting enough, it's easy. I'm all in. I'm hyper focused. If it's the right level of difficulty, not too easy, not too hard, you're focused. If it's urgent, a real deadline or a time pressure, you're good. Like, you perform at your best, right? Okay. So in this video, I'm just going to focus on interest. What's the meaning of interesting? If something is interesting, and how do we basically reverse engineer that to make studying more interesting? Okay. So interest is a psychological state where something basically captures your attention, engages your curiosity, and motivates you to learn more about it. So during studying or learning, things become interesting when they present a gap in your knowledge. Like, you notice you don't know something and you want to fill it. So luckily, studying is not that boring. We have circuits in our brain that enjoy learning and thinks of learning as interesting. And I'm sure, you found some rounds or lectures in medical school interesting enough. So interest isn't just attention. It's when your brain senses that something matters enough to explore. It's a psychological state where the concept captures your focus, triggers curiosity, and motivates you to dig deeper. So when you're learning, things become interested the moment they expose a gap in your knowledge. And focus with me here. When you realize, wait, I don't know this. The moment of uncertainty activates the brain's curiosity circuits, and your mind basically wants to close that gap. Luckily, your brain isn't wired to enjoy learning, okay? So how do you spike that interest while studying? It's simple. By asking better questions. The USMLE is designed this way. It's designed to pique our curiosity, to work on that. It's built around questions. That's why you can go into the exam and stay 8 hours without, losing interest, because you're focused on activating these circuits, right? So every question naturally creates that gap in your understanding, which automatically triggers curiosity. And that curiosity is what releases dopamine. It helps you, it pushes you basically to think, reason, and learn deeply. Okay, so that's the key here. And luckily, the USMLE is a question-based. Every question creates a gap in your mind that automatically makes your brain curious. That curiosity releases dopamine, and that's what drives you to think and learn. But what's the problem? So the USMLE is good. The problem is the USMLE questions are long. You have to read a full case before even knowing what the question is asking, right? That delay means your brain has to spend a lot of dopamine just to reach that point. And oftentimes, it runs out before you get interested, okay? So for ADHD brain, it's very tough to read through the entire question without dozing off. So what's the solution? And this is the part where I want you guys to focus very well. It's very simple. Don't tackle the whole question at once. And look, you can use willpower to focus. You can try to force yourself, but that will create if you are pain, like if you have pain while studying, that will create a bad negative reinforcement, and that's not good for you. So when you're studying, if you're doing questions, don't tackle the whole question at once. Break down the question into pieces, one mini question at a time. Each question creates a small curiosity gap that your brain needs to fill. So your brain just needs a small burst of dopamine, which is you probably has as an ADHD student, to engage and find the answer. So I used to do this during my step 2 prep when I was studying when I was using UWorld. Whenever I opened a long case, I didn't even read it straight. Like I broke it down into smaller, manageable chunks. Each part became its own little question that I could actually think about without zoning out. So you have no problem in thinking. You can actually think very well. So the problem is you can't really focus while reading, right? So instead of reading one giant paragraph and losing focus halfway, I'd read one clue, pause, think, and visualize it, and then move on to the next clue, connecting them together. Think of it like a chain. So it's a chain that you're basically pulling your attention, as if you're pulling your attention forward, like a rope, from one question to the next. So your brain just makes these connections between questions, and this is how I kept my brain engaged and stopped it from drifting. And if you notice, if this is pretty much fun, like this is fun, solving questions that you have, creating curiosities, or being curious and solving this gap that the brain has, oh, like I want to know what the answer to the question is, fun. And what's good about that, it creates this positive reinforcement about studying that doesn't make studying painful. You get addicted to studying, and you study longer and without fatigue. So that's the simple idea for the video. I try to make it very simple for you guys to understand, and in order to just apply what I said, okay? Break down the question into small questions and use the chain mindset. And in the next video, I'm going to talk more about like how to create questions and how to study. Like I'll try to make a video on how to study from the questions using this technique. Okay, so the better the questions, the better quality learning, the more fun you have, the more engagement you have, the more attention you have as an ADHD student. Okay, thank you so much. I'll see you in the next video.